When we deal with informed consent, certain things must be done. Number one, informed consent must be voluntary. If you coerce a patient to sign a document, then of course that is not voluntary and informed consent would not be valid. You must understand that the patient needs to have certain things explained. For example, what are the risks of the procedures? What are the benefits of the procedures? And of course, what are the alternatives of the procedure? And the patient must have the capacity to sign that informed consent. So if you're trying to get informed consent from a minor who is not an emancipated minor, then of course you know that that consent would not be legal, or valid I should say, because we do not get consent from minors. So always make sure that the individual is competent to make that decision. Now, do we always need informed consent? No. There are numerous exceptions. One of them, it's an emergency. Patient gets brought into the hospital, unconscious, bleeding internally. We have minutes to hours before that patient subsides. What do? Do we wait for the next of kin? Do we wait for the patient to become aroused before we get them to sign the consent? No. Because it's an emergency procedure, you can go ahead and do whatever you think is necessary. Another exception is waiver by the patient. Many patients will tell their doctor, just do what you think is best. Those are the patients that, of course, do not need to sign anything, and you just do what's best for them. Of course, the patient must sign this waiver. Another concept is therapeutic privilege. You can technically withhold information from patients if you believe that that information will be detrimental to the patient's well-being. In those situations, then you can withhold information and you may treat your patients accordingly.